Peripheral arterial disease is a very common underdiagnosed condition. If a patient has symptoms where they're having pain when they're walking in their muscles, that gets better when they rest, and then when they start walking again it comes back and limits their walking distance. If they're developing non-healing sores or wounds that are very poorly healing, that can also be a sign of peripheral arterial disease. And furthermore, if they're having pain at night in their feet or toes, that's keeping them awake at night, that may also be a sign of advanced peripheral arterial disease that probably needs treatment. One of the advantages of coming to our practice is that we can provide a very comprehensive way to evaluate and treat these patients. And the patient may have, for instance, pain that's coming from a blockage in the artery, or at the same time might have a problem that's coming from their veins not working normally, and or even a blockage in the veins. And or they might have pain coming from damage to nerves in their lower extremities, and or even coming from pinched nerves in their spine. And we can really sort these out for the patients and figure out which is the real cause of the patient's problem, and also know if there's more than one cause or even 2 or 3 causes. Because our specialty is basically kind of comprehensive. We treat back pain, we treat peripheral arterial disease, we treat venous disease, we treat neuropathic pain. So as a result, we know how to recognize that better than a lot of other physicians who might treat maybe just simply peripheral arterial disease, or who might treat spine-related pain, for instance. We have quite a lot of experience in helping patients who are really at the end of the rope in terms of potentially needing an amputation if we can't help them. Working below the knee is a much higher order of magnitude in terms of the difficulty. The arteries that we're working with are very fragile, they're very small. In fact, they're only about 2 millimeters. If you know what a millimeter is, I'm talking about like just a very, very small pencil lead thickness artery. And these arteries yet are vital to the circulation of the foot, for instance. And when they get occluded or when they get blocked off, there's basically an emergency situation to the foot. And this happens very commonly, though. And how do you fix the problem? Well, a lot of these patients, they're not surgical candidates, and we can help in this situation where it's a limb-threatening situation, and we can go down into these very tiny arteries and work very meticulously and carefully to open up blockages and restore the circulation. And this is a level of expertise that I would say that a very small minority of physicians have. If our treatments where we actually go inside the arteries themselves doesn't work, where we remove the plaque or we dissolve the clot, or we stent or balloon angioplasty the blockages to restore the circulation, we can also go one step further, where we can actually use spinal stimulation to increase the circulation to the foot without actually directly affecting the arteries. And that's, again, something that is proven to potentially help with healing of wounds that are not healing, and also to prevent amputation.